Hello, hi again. My name is Alice John, your favorite dietitian. Today I'm talking about diabetes. What is diabetes? Diabetes is a condition that affects the way your body uses food. Everything you eat becomes sugar. 100% carbohydrate is converted to sugar, 60% protein is converted to sugar, and 10% fat is converted to sugar. So it means when you're diabetic, you eat this food, it becomes sugar, but your body cannot utilize this sugar. And so you have to be put on treatment to lower your blood sugar. But what do you think would be the best way of managing your diabetes? Would it be drug or would it be diet and medication? Really, it depends on how high your sugars are. Sometimes you require medication straight away. Sometimes you can actually be started on diet. But why am I saying this today? When I was 23 years old, I was diagnosed with type 2 diabetes. I used to work in a diabetes care center, somewhere in South Bay, managed by an American nurse called Jean Sobel. I was learning diabetes because I wanted to manage people with diabetes. At the time, I was working Kenyatta and part-time I worked with on Saturdays and in the evenings. Then one day, as we were testing the blood sugar, she tested my blood sugar and it was 9. It was like 4 or 5 hours after food. It was a random blood sugar. That was high because it was towards evening. Then she said, maybe sugar is high and you should be worried about it. And I was like, no, I cannot be diabetic. So we decided to do a fasting blood sugar. That means I didn't eat anything when I woke up in the morning and the sugar was 9, which is a diagnosis for diabetes. It was not pre-diabetes, it was diabetes type 2. I cried myself stupid. I was so devastated. I started imagining all those things I hear about diabetes, blindness, heart disease, amputation, kidney problem. And I was like, I am not going to get those. So of course, as a young graduate of nutrition, I decided to apply what I learned in school. To be honest, I had not been practicing nutrition. I am practicing nutrition with patients, but not in myself, not in my life. So I decided things have to change. I read more about diabetes. I read more how to control my diet to manage my diabetes. I changed my eating habits, stopped taking sugar, stopped taking juices and sodas and all those things, and just watched my portions. I ate more food in the morning, very little or moderate at lunchtime, and at dinner I ate very little and never had any protein. I exercised, and within 6 months, I was my medication dosages had dropped, and they monitored me for another 3 months, and my medication was removed. So meaning I literally, with the help of Ginsuren, I reversed my type 2 diabetes. So now I can say I'm still diabetic, but with diet and exercise. I don't choose medication. So over the years, or 20 years later, I am still not on medication for diabetes, and I'm really normal. So what am I saying? Learning about that at an early age as a young nutrition professional, I've had the passion to help people with diabetes reverse their diabetes or even have better control. Not everybody can reverse. Type 1 cannot reverse, but type 2, you can reverse it or you can have better control. There's no use taking lots and lots of medications. Like you're taking a lot of pill, maybe in 1 month or 3 months, you're taking this much medication to manage your diabetes. And remember, diabetes, when you can't control it, it also brings along its sinister friends, blood pressure, high cholesterol, and many other complications. So what am I saying? Please, if you are a diabetic person and you've never seen a dietitian, you need to see one. In Kenya, we have dietitian in every health facility, government health facility. So find one, go and see them, they will help you with diabetes. At the Technical University of Kenya, all our nutritionist graduates are taught how to manage diabetes. And I've had the pleasure of working with a lot of them and even doing case studies. So please, my dear friends, do that. And what's more, I am here, I am waiting for you so I can help you control your diabetes better or reverse it. We have a program called the Diabetes Control Lifestyle Program. It's a 12-week program where we help you to learn about diabetes. Remember, when you have the knowledge, then you know what to do. I know when I was diagnosed with diabetes, I had to learn about the numbers. What is a good blood sugar in the morning? What is a blood sugar 1 hour after meal, 2 hours after meal? What are the foods that trigger my sugar? I had to keep good records so that you can diagnose and realize that, oh, when you eat pasta, it's always shoots your sugar, even if it was brown pasta, even if it was normal. And over the years, managing many patients, I have realized different patients have what actually triggers their sugars. And so with a lot of education, you can control your diabetes better. You can avoid complications that come with diabetes. Things like kidney problem, amputation, blindness, sexual dysfunction, heart problem. You can avoid all this by really not knowing your diabetes. I work with top endocrinologists and even young ones. So I'm not doing this alone. With the doctor, we manage you together. We manage your medication, manage your diet, reduce when you need to, and we're always in constant communication. So my dear friends who are out there who are diabetic and wondering, will I ever get control of this? Yes, you can. So I look forward to seeing you in my program, or I would like to hear that you have visited a dietitian to control your diabetes. Please, dear friends, if you've never seen a dietitian, you need to see one. Dietitians can really help you and help your family. I do care about you, and in my second half of life, what I want to do is impact thousands and thousands of people. This is what I want for you, just the best. So remember that genes load the gun, but your lifestyle is the one that pulls the trigger. So if you have a risk for type 2 diabetes, it is your lifestyle that can pull the trigger. So we need to learn how to manage our lifestyle better. And also taking drugs without eating properly is like washing your hands and drying them in the dirt. So please, you need to learn how to eat. So if you haven't done so, all the dietitians in this country are waiting to help you. We love you and we look forward to working with you to manage your diabetes. All the best from Dr. Alice Echeng Ojuang, Katikro Jetitro. Take care.